Michel, it's great to have you here at Abu Dhabi Global Healthcare Week. Thank you so much for joining us.
Pleasure.
I want to kick off just by asking you to walk me through how you see the UAE's role when it goes to health and healthcare, because this is a country obviously that's been at the forefront of innovation over the last decade or so. We saw that in their treatment of COVID-19, for example, and today they're working to be an incubator for all of the revolution in this space.
Yeah. I think that they have a great role to play, and the fact that they are taking such a proactive role, especially in all the areas of digital and data management and artificial intelligence. I believe that the developments that you see here is something that can become a role model for the rest of the world. Obviously, they start from a lean basis. They have also financial resources to build it up pretty fast. But I think every health system in the world will be able to inspire themselves from what is being done here to try to modernize a little bit their own capabilities much further than this.
Walk me through that, because obviously you're very, very well placed to talk about the possibilities when it comes to private and public partnerships.
Yes. Well, obviously the most talked about partnership that we are talking about here in Abu Dhabi is this partnership for health system sustainability and resilience. That is a partnership that we decided to initiate together with the London School of Economics and the WEF in the aftermath of COVID, because COVID had a disastrous impact on health, obviously public health in the world, but also on health systems. The health system have been left in a really very difficult financial situation, totally under-resourced, totally under-skilled, overstretched in terms of expectation from the general public. And we felt that we had to really start working on this to try to improve, because if you don't have a healthy ecosystem, there's no possibility for innovation, there's no possibility for health equity. And we also said we cannot do it alone. And so it was very important that we put together this private-public partnership, which is putting together public servants, academia, NGOs, and businesses, and try to think together as a solution for the future. And what we are trying to do is really go country by country, appoint in these countries a number of experts and academia that can really provide an in-depth analysis of the status of a health system, have a really serious assessment based on evidence, and then come with recommendations to try to make it work. Then again, we put everybody around the table, all the players, public, private, and try to work together at solution. And I think that is also the great things that come out of the PHSSR, is that it's not just only a report that I gave you, you're going to put you in the drawer and say thank you very much, but we are there to follow up with actions. And we have heard, for instance, this morning, the Greek Minister of Health, who emphasized how important it had been for him when the Greek health system was almost bankrupt and it was totally falling apart. And they took this report and they really followed step by step to rebuild, and today are in a much better situation. So it gives a lot of hope that when we work together, we can achieve something.
What do you think is the next step? Because we've been talking so much here about innovation. We've been talking about wearables. We've been talking about AI. Yeah. What is the next step in your mind?
You know, if you take the average of OECD countries, the budget that is devoted to prevention is 3% of the total healthcare budget. And so if you only pay 3% for prevention, you end up spending most of your budget on hospitalization and late treatment. So the more we can shift the balance to have much more done before, it's going to be much better for public health to try to make it happen.
So beyond that, obviously the incentivization has to come from policymakers, from the government. Yes. And in terms of big pharma, what do you see your role in the next 10 years? Because some would say, okay, will you make as much money? Because in the end, you're a business, you have to make a profit, you have shareholders, I mean, you have responsibilities. So how do you have that win-win?
That's for sure. And besides that, we have especially to invest in R&D, and we're taking enormous risks.
Every time.
Obviously, people see the success and the money that is being made, but there's also the projects that don't work that you have to write off, and we are talking billions of dollars here. Each time you spend a phase, the gamble becomes much bigger. So there is for sure a need to continue to be able to invest in R&D, and have after that a proper period where you can amortize your investment so that you can continue investing in the future. So that is very important. But we see at AstraZeneca our role much broader than that. It's also a role of keeping this whole ecosystem around us viable and prosperous, so that every actor has a role to play and can contribute to the fact that at the end, what we need is not only a good public health, but also health equity. Everybody should have access to the best medicine in the world, and that can only happen if you have a health system that is built solidly and that can support everyone. And then let's not forget also the sustainability aspects. At the end, the healthcare industry overall is responsible for 4 to 5% of the greenhouse gas emissions. And so there as well, you can think of all the things you can do with digitalization. The more you can do home care instead of getting people in hospitals and all that, you save for the comfort of the sick person, but you can also help the sustainability linked with this. So there's a lot of interconnected issues here that we try to address. And I think we, as Big Pharma, can have a big impact if we spend the time on this and to feel the impact we can have.
Michel, it's great to have you here at Abu Dhabi Global Healthcare Week. Thanks so much for joining us.
Thank you very much. It's a pleasure. Thank you.